the 17th World Congress of Neurosurgery that will be held in Bogota next year, August 29 to September 3rd. Okay, the epidemiology of the trauma, the spinal trauma, the incidence in the world has increasing, with an estimated annual incidence in 10.4 to 83 cases per million. The incidence of spinal cord injuries varies between 20.7 to 80 in USA and 8 to 130 in Europe per million a year. The annual cost of up to $267 billion US. Let me see. I don't know how. Sorry that.
Enrique, it's at the bottom left. If you take your cursor down bottom left, you will see the.
Yes. Okay. Yeah. Okay.
Thank you.
Okay. Thank you. And the average age in patients with a spinal cord injury is 39.8 years. They tend to be older in Western Pacific region and younger in United States and Canada. Men 3.37 and women one women. It's more in men. Injuries in the cervical spine is 46% of all the spinal injuries, and the lumbosacral spine is 24%. The traffic accidents produce 39.5% of the spinal cord injuries, and the falls 38% in the world. The falls mechanism in low-income countries is 54% of the cases, and the violence is another important issue. And the sports-related injuries are rare in middle-income countries, and the United States and Canada is 8%. And the violence mainly due to penetrating trauma from firearm projectile. In Brazil, 42%, Sub-Saharan countries, 38%, South Africa, 25%, and USA, 11.7%. Some countries, such as Norway, Australia, and Canada, incidence is of less than 2%. Some countries, such as Finland and Israel, the spinal cord injury is associated with suicide, that in 10% of the case. Occupational accidents is reported in at least 15 in all spinal cord injuries. The use of alcohol or drugs has been identified as an associated factor in 34% of all cases with traffic accidents. You can see in this map the annual incidence per 100,000 persons in the world. 3 in yellow and 14 patients in green. You see that the principal, the bigger amount is in the South countries, in Latin America, Africa, South Asia, Australasia. And then USA and North America, and some countries in Middle East. And the least incidence is in Europe and Russia. But it's important to see that the majority of the cases of a spinal injury are in the low medial income countries. there are 8 times more than in the high-income countries. The mortality in spinal cord injury is 0 to 60%, and the 36% and 59% require surgical intervention. And the mortality is higher in a spinal cord injury patient due to the traffic accidents, mortality between 40 to 50%. And the spinal cord related to falls is in high income countries tend to be related to falls in the elderly, while in the low income countries is related to the falls at work. For the prevention, there are this organization, the International Spine Cord Society, with the World Health Organization, create guidelines to prevent the spine cord accidents. And the best intervention to prevention of the spine cord associated to the road traffic crashes are legislating and enforcing drink driving laws, include alcohol concentration, use the seat belts, use of child passenger restraints, motorcycle helmets, setting and enforcing speed limits, including the use of speed cameras, reduce speeds around schools, hospitals, etc. Daytime running lights for motorcycles, and road designs that separate pedestrians and two-wheelers, cars, and heavy vehicles, area-wide traffic calming measures, and graduated driver's license systems. And for prevention of the spinal cord related to falls, it's important to floor clear of clutter and loose rugs, provision of good lighting, handrails and appropriate little furniture, window guard and high-rise buildings, barriers on roofs, safe harvest equipment, well barrows where applicable, and enforcement of building regulations, education of parents of young children, workplace regulation that limit weights carried on head and age of workers. And to prevent to work activities or occupational accidents, it's necessary to obtain data on the magnitude of the problem, hazard identification, if it's geological, hydrological, seismological, and rock evacuation process, the risk analysis and assessment, identification of the protective factors, design and implementation of the interventions to control risk, strength enforcement provisions and address offenses, monitor and review. And to prevent sports-related spinal cord injury, the cervical is common at the level of SIG-4 with resulting tetraplegia in most common form of diving related. This type of diving injury is most often seen in men under the age of 55. And then to prevent the spinal cord associated to the sports, in general, the educational programs as the most important. In rugby, mandatory safety training for coach and referees, diving legislation and enforcement to safe pool designs, and with deep lighting, diving, board height, and elasticity, prohibiting of the alcohol around water sports. And general sports, the playground standards for the depth of appropriate surface material, height of equipment, and maintenance. And in deep sea diving, early access to the decompression chambers. And in conclusion, the traumatic spine injuries produce a high percentage of morbidity with multiple disabilities. This represents a high cost to the society and high mortality rate. And we have to prevent. And for the prevention, there are principal these issues. Equity, of course, but the control of the violence, the education, the regulation, and the infrastructure of human and facilities. And in 2016, we made the declaration of Bogota. Here you can see Dr. Andres Rubiano from Colombia, Dr. Mera Cheiran from India, the health vice minister of Colombia, myself, Dr. Franco Servadei, president of the World Federation, Dr. Andrew Mas, at that time, the chair of the trauma committee of the World Federation, Dr. Walter Johnson from the World Health Organization, and Dr. Key Park, the president of the Global Neurosurgery Committee of the World Federation. And in this declaration, we therefore hereby declare global neurosurgery as the collective and unified effort in improve all aspects of neurosurgical care whenever and wherever it is needed. And we have in Colombia a Neurotrauma and Global Neurosurgery International Fellowship, leading by Dr. Andres Rubiano in Cali. And we had applications in 2020 from Cuba, Pakistan, Nepal, Egypt, Venezuela, Qatar, Uzbekistan, and Emirates. And we promote that in all the countries around the world, we have the possibility to have the infrastructure necessary to attend the spinal cord trauma, the neurotrauma in general, and with the human people, the preparate with the professionals. And again, our invitation to the 17th World Congress of Neurosurgery in Bogota next year, August 29 to September 3. Thank you very much.